Hello, good day, and welcome to our webinar today, looking at challenges and questions around effective respiratory protection for employees in the steel industry. I am Andy Purvis. I'm Director, Safety, Health and Environment with the World Steel Association, and we're delighted to be partnering with 3M to bring you this webinar today. I just have a few small items of housekeeping before we get into the meat of the presentation proper. World Steel operates under strict antitrust guidelines to ensure that all of our members, and indeed any other people from the steel industry who will be working with us, can do so safely. If you'd like any further information on our antitrust rules, you can find a full set of our guidelines on the website. So I would like to start with introducing today's speakers. Given, and maybe a little bit of background, given there was clearly a lot of interest in PPE from around the steel industry and from around our membership in the context of the current COVID-19 crisis, with people not entirely sure what type of PEP to use for what circumstances. World Steel then reached out to, I think, the leader in the field of PPE, 3M, to ask if they'd be willing to partner with us to share their expertise to the broader steel community. And I'm very delighted that they agreed to do so in order to support their customers. We have two speakers today from 3M. The first is Scott Shinn. Scott is an industrial hygienist and application engineering specialist within 3M's personal safety division, and he's worked for more than 25 years in health and safety program management, in consulting and in other areas, particularly focused on PPE. He has a degree in biology and industrial safety and hygiene. So Scott will be speaking to us today, along with Stewart Ayrey. And again, Stewart's been with 3M for over 20 years and has worked for the last 11 years purely in the PPE team. So he's a real specialist on protective equipment, product development. These, I think, are definitely the people we want to be hearing from with the questions you all have in the current situation. Now, regarding questions, we will collect questions during the webinar. So my ask is you would please use the Q&A function in the GoToWebinar panel. So please don't use the chat function to ask questions, and don't use the question function to chat, as that will just confuse the gentleman we have here trying to collate those questions and bring them together. You can ask a question at any point, type it in and send it. We will then collate those questions and we'll have some time at the end of this webinar in order to pose those to our presenters. So you don't need to wait till the end to type your question in. If one of our presenters says something that prompts that question, please type it then. So I've said my piece. I will be back at the end of the presentation to help and be part of the question discussion. But I would like now to pass over to our expert presenters. So thank you.
Hello, everybody. My name is Stewart Ayrey. Thank you, Andy, for that very nice introduction, and our thanks from 3M to the World Steel Association for this opportunity to speak to you all today. I'm going to start us off, and halfway through, I'm going to pass over to my colleague, Scott Shinn. So just to set the scene and just to kind of get a few things out there on this disclaimer, when you're looking at PPE, please always read the user instructions supplied with the item you've got, comply with local laws and regulations, and of course your own company policies. A really important point around COVID-19 is that things are rapidly changing. Our understanding is changing, government guidance is changing. So the information in this presentation is current as best as we can make it as of today. Things may change in time, and I encourage you to keep checking the guidance which is applicable to you in your local country or region. If you need any help, please find or ask for help from a qualified health and safety professional, or please contact 3M, we're here to help, or the World Steel Association. The agenda for the 3M part of the presentation is to look at four things. One, an overview of risk assessments and particularly considerations for COVID-19. Then we'll look at, in number two, implementing controls to minimize exposures to COVID-19. Briefly, we'll look at some medical considerations. And then I'll hand over to Scott, who will look at some frequently asked questions in depth and give some very specific guidance and information to you. So first of all, let's look at a risk assessment. Not always the most exciting of topics, but critical to the implementation of any health and safety plan or program. The first thing to do is to go out into the wide world and find what the local, national, or maybe international advice and regulations are. Organizations like the World Health Organization have produced some very useful documents which give really good practical advice to employers, general public, and the healthcare industry all around the world. There's some very specific ones as well I'd like to draw your attention to. The OSHA, that's the US OSHA guidance on preparing workplaces for COVID-19, is an excellent document, and we'll make reference to it throughout this presentation. There are other documents from the CDC, OSHA, and the like, which are very useful too. And of course, World Steel Association have produced very valuable documents which are frequently updated on health and safety, in particular around this COVID-19. And we 3M have a website which we'll share the address at the end of the webinar, which has got lots of interesting and informative documents around selection, use of all sorts of different items of PPE and guidance around the entire topic. So guidance is out there. There is a lot of it and it updates regularly. So looking at our risk assessment, what do we need to do? Well, the first step often is to review our existing risk assessment. Make sure that they are accurate and up to date. Then maybe review the relevant and applicable guidance as we just saw in the previous slide. From here, we can conduct a COVID-19 specific risk assessment in line with that guidance. And as required, we can come up with some sensible measures to manage the transmission risk. Be aware though, you may face some very difficult decisions. It may be the case that work cannot continue because controls cannot be put in place. You must also think about workers who may be particularly vulnerable to COVID-19 due to either their role, their exposure to others, or perhaps their existing medical conditions. And then we also need to particularly consider if PPE or the implementation of masks or respirators is part of our control measures, implementing these controls for workers who don't normally use PPE. They may be office workers or people who aren't normally exposed to hazards, so they will have some particular training requirements. So when we're looking at our risk assessment, we're looking at some point to break the chain of infection. And this is the chain we can see on screen. All of these things need to be in place for transmission to occur. The infectious agent is the microorganism. It could be a bacteria, a fungi, a parasite, but we're here talking about COVID-19, so that's a virus. A reservoir is the place within which microorganisms can thrive and reproduce. So we're mostly talking about humans, but we have seen outbreaks of disease in animals, and reservoirs may be in other places, not living. They could be in bodies of water like lakes, rivers, etc. A portal of exit is the means of the microorganism to leave the reservoir. So this could be for a human, a cough or a sneeze, or even just talking aloud. All of these will be putting droplets and particles into the air potentially a means of spreading the virus. Which brings us to the mean or mode of transmission. This is the route or method of transfer by which the infectious microorganism moves or is carried from one place to another to reach the new host. We'll talk a bit more about these in a moment. The portal of entry is the means by which the infectious microorganism gains access to the new host. This could be through ingestion, so maybe eating contaminated materials or putting contaminated fingers into the mouth, breathing in, skin punctures, a whole manner of different mechanisms. The main mechanisms for SARS-CoV-2, or the coronavirus we're currently concerned about, it's believed to be main portal of entry is believed to be the mouth and the nose. So this is why we're seeing facial coverings being used and other things like this. We'll talk more about this later. A susceptible host is a person who is susceptible to the disease, lacking in immunity or a physical resistance to the microorganism. Currently, the experts believe all humans are susceptible, but more are susceptible than others, or their symptoms or the development of the disease can cause significant morbidity. So let's look a little bit at those transmission methods or modes of transmission. The yellow circles are direct transmission. Direct contact is through skin-to-skin contact or exchange of bodily fluids. Droplet refers to spray of relatively large droplets which are short-ranged, and they are produced by sneezing, coughing, or talking, as I mentioned before. Droplet spread is classified as direct because transmission is by a direct spray or transfer over a few feet or a meter or so before the droplets fall from the air. So we're almost going from droplets from mouth directly to the mouth or nose of the new host. The green circles refer to indirect transmission. Airborne transmission occurs when infectious agents are carried by dust or droplet nuclei suspended in the air. Droplet nuclei are dried residue of droplets, which are probably, roughly less than 5 microns in size. In contrast to droplets that fall to the ground within a few feet or a meter or so, droplet nuclei can remain suspended in the air for long periods of time and may be distributed over distances too. Vehicles are where an infectious agent is carried by something else. It could be food, water, a biological product, or fomites. And fomites maybe have a role in COVID. These are inanimate objects like handkerchiefs, door handles, which are contaminated with the virus. And the other one on here is a vector. So that is something like a mosquito or a tick or a flea biting an individual to transfer a virus. So just to reiterate, currently we believe contact and droplet transmission are the primary means for the transmission of the SARS-CoV-2 virus, which causes COVID-19. But people do also talk about airborne, mainly around healthcare workers undertaking particular procedures. No organization is saying that the virus, the COVID-19 virus, is currently airborne transmissible. But we won't know for sure until all of this crisis is over, perhaps many months or even years from now. So looking a little more, at the application of our risk assessment. As part of any risk assessment, we need to identify which groups are at greatest risk of exposure and understand what groups have similar exposures and try to group them together into similar exposure groups. At this point, OSHA has some exceedingly good guidance, and on screen you can see an excerpt from their document. They have categorized occupations from very high to low risk. When you read the descriptions, healthcare and medical personnel almost exclusively fall into the very high and high categories. Almost no industrial worker would fall into these groups. Very high would be a healthcare worker who is conducting an aerosol generating procedure, or lab workers handling samples, morgue workers conducting autopsies involving aerosol generating procedures. And high exposure groups would include healthcare workers who are attending closely to confirmed or suspected infected patients with COVID-19. Medium risk, though, is where we may classify some of our workers. Medium risk exposure jobs would be those that require frequent or close contact within 6 feet or 2 meters with people who may be infected with the virus, but are not known or suspected to be infected. So in areas where there is ongoing community transmission, which is almost everywhere around the world, workers in this category may be those who have contact with the general public or need to work very closely with other workers. Lower risk groups would be people who don't require close contact with others. They have no contact with suspected infected people, and they can avoid occupational contact with the public or co-workers. Now, I'm currently working at home. I would be classified as a lower risk worker, but there may be people in your workplace who have to work closely with each other, and they could be in the medium risk category. So, having done our risk assessment, we've identified maybe some people who need control measures implementing to minimize the risks of exposure or transmission. Let's look at what measures we can put in place. Well, no presentation like this is good without the hierarchy of controls, and we can learn a lot from the hierarchy in implementing transmission control measures. First of all, we need to look right at the top at elimination. This may be quite difficult with COVID-19, but we've got to look at any way we can eliminate or get rid of the hazard altogether. Substitution comes next. What other steps can we do or put in place in the process to eliminate the hazard? Again, quite tricky to implement in the workplace around COVID, but elimination and substitution are the first controls to consider for normal occupational hazards. Engineering controls are then third. These are processes or controls we can put around existing processes, applications, or facilities to reduce the exposure to the hazard at the source before it poses a risk to the workers. So this could be things like local exhaust ventilation for an industrial hazard. It could be barriers, sneeze guards, or perspex sheets which separate workers to give some distancing and a barrier to the transmission of droplets. There are many things we can consider. Administrative controls come next. Things like, as you can see, safety signage, job rotation, working with shift patterns to minimize workers working with multiple different people. Changing shift patterns so there's less people on a factory floor or in the workplace at the same time. Things like enhanced cleaning, all of these fall into administrative controls. And finally, we should consider PPE, because PPE relies upon the wearer to use the item of PPE, to wear it correctly every single time. So many things can go wrong. and the use of PPE should only be considered when all of the other controls have been evaluated, exhausted, and found to either not be practical to implement or do not adequately control the exposure. So please don't jump immediately to buying respirators or masks. Think about those engineering and administrative controls around COVID-19 first. But I work for 3M and we make PPE, so we're here to talk about PPE. So when you are doing your selection and use, you need to think about two key things. Is the PPE, the respirator, adequate, and is it suitable? By adequate, we mean, is it right for the hazard? Will it reduce the exposure? Does it have a sufficient protection factor? It's hard to know what an adequate level of protection for COVID-19 is, as there are no occupational exposure limits and no easy means of measuring exposures in the workplace. So you often have to rely on guidance from authorities, and there are some very good examples out there. If in doubt, try to reduce exposure to be as low as reasonably practicable. Suitable. Is the PPE, the respirator, right for the wearer, the task, and the environment, such that the wearer can work freely and without additional risks? So this might mean, does it fit the worker? We have male, female workers, large, small people. Does it come in the right size? Is it sizable, adjustable? What are the workplace conditions like? High temperatures, radiant heat, lots of noise. What level of training is required? Does it fit the worker? Is it comfortable? What level of work intensity is required? Is the respirator reusable, single use, etc.? Many, many things. And just to illustrate those, here are two different workers wearing respiratory protection and a level of eye and face protection. The lady on the left may be wearing adequate and suitable PPE for a healthcare worker dealing with patients suspected infected with COVID-19. But that ensemble of PPE for a healthcare worker would not be suitable for use in many steel places of work. The gentleman on the right perhaps is wearing something which provides a similar level of respiratory and eye and face protection to the healthcare worker, but it is suitable for him and the environment and the tasks he is performing. So when we're choosing PPE, we need to, of course, consider the hazards in the workplace, the normal hazards. And as you can see on screen, there's a multitude within the iron and steel industry. Chemical hazards like polycyclic aromatic hydrocarbons, metal fumes, silica, fibers, gases and vapors. Physical hazards like working at height, noise, vibration, heat and radiation. Safety hazards like slips and trips, ergonomic issues with manual handling. Psychosocial hazards, which can affect mental health and well-being. And of course, something maybe you've not considered before, biological hazards, bacteria, insects, animals, mold, fungi, and of course, the SARS-CoV virus. So when you're considering, you're selecting which type of PPE to use, what type of respirators, you've got a range of options, masks and respirators. The key thing here is to understand what they can and cannot do. Masks, the first three, they are loose fitting and they are intended, or some of them are intended, to protect others by capturing particles expelled, exhaled by the wearer. We don't know what homemade mask coverings can do, but certified and tested masks can do that. Some, like surgical masks, also can provide a fluid barrier to fluid splashes, like in surgery. But it's only respirators like filtering face pieces, elastomerics, and powered air purifying respirators which give a recognized level of respiratory protection to the wearer. Some may also protect others, like unvalved or shrouded valve filtering facepiece respirators, and some of these respirators may be readily cleaned, disinfected, and reused. There is a wide range of respirators in the market. Very quickly, they're split into air purifying, those which pull air through a filter, taking out the contaminants as they pass through the filter, and then supplying it into a facepiece or a hood. Negative pressure ones rely on the worker to breathe and inhale and pull the air through the filter. Powered use a battery-powered fan to pull the air through. The alternative are atmosphere supplying, continuous airline or self-contained ones. Self-contained might be like what a firefighter wears. But if we're choosing a respirator, a tight-fitting one, we need to ensure that we wear the respirator right. It's put on the face correctly. The headbands are in the right places. One on the crown of the head, one around the neck. The nose clip is properly formed. We need to conduct a user seal check before entering the workplace. And as regulations require, you should be fit tested before entering the workplace and annually or on whatever repeat basis is required. Facial hair is a topic which is raised commonly. Can I wear a tight-fitting respirator with facial hair? Well, facial hair can interfere with the tight seal of the respirator to the face and create a leak path. So you can wear facial hair with a tight-fitting respirator, but only if it is not in the area where the tight-fitting respirator needs to seal to the face. What is clean shaven? Clean shaven is what we're looking for with a tight-fitting respirator. We're talking about people being clean shaven within 8 hours of the start of the shift. So it's a big issue in industry. It's a challenge for many employers when implementing a respiratory protective program. And for religious reasons or for medical reasons or in other cases, you may have to consider respirators which can be worn with facial hair, and they would be loose-fitting powered air respirators, for example. Medical considerations. In some regions around the world, employers need to conduct a medical evaluation of respirator wearers because not everybody is medically able or fit enough to wear a respirator, particularly those tight-fitting negative pressure ones. So do comply with your national regulations and company policy. But also consider that some workers who have been infected with the virus and have been ill, they can have an extended period of time to recover, and it can take them many weeks to recover. So they may need different respirators when returning to work. A powered air respirator may be more appropriate. So that's a quick summary of respiratory protection programs. So I'm now going to hand over to my colleague Scott, who will take us through 3 specific questions.
Great, thank you, Stuart. Very well done. Great overview of the risk assessment process. Let's get transferred over here. For the remainder of our presentation, I'm going to cover a few frequently asked questions we've been receiving regarding the COVID virus and respiratory protection. These are going to cover alternatives to respirator options due to possible supply shortages, PPE options for workers who do not normally wear respirators and cannot socially distance, and effectiveness of existing respirators in the workplace worn by workers who cannot socially distance. So those are the 3 areas I'm going to cover. Let's start. If I can get my slide to change here. There we go. Question 1, alternative RPE options due to possible supply shortages. The U.S. Center for Disease Control has published some interim guidance for conserving and extending filtering face piece respirator supply for non-healthcare sectors, obviously which the steel industry would fall. They have come up with a number of steps that can be followed to achieve this end. One is more long-term thinking, and of course, following the hierarchy of controls that Stewart went over, eliminating or substituting the hazard whenever possible or feasible. A second one is more of a short-term thought that implement immediate feasible engineering and administrative controls. And I'll go through each of these steps in a little more detail as I go along here. Use of qualitative fit test methods in place of a quantitative method to conserve RPE. Alternative types or classes of certified respirators. Ways that we can extend the service life of respiratory protection. The use of respiratory protection beyond the manufacturer's shelf life for training and fit testing. And use of approved RPE or RPE approved to other country or region standards. So I'll go through each of these individually in a little more detail. Again, long term, right? We want to look at eliminating or substituting hazards and implementing engineering controls wherever possible. We always want to follow the hierarchy of controls, and Stewart did a great job of reviewing that. I'm not going to go into a lot of detail. Just be aware that there are additional controls, especially on the administrative side, that we can consider when we look specifically at the COVID or SARS virus. These may impact how you communicate with your workers. Companies have implemented daily wellness checks. If an employee or worker is not feeling well in the morning before shift, he reports that to the supervisor and is asked not to come to work. Another thing that's been done are daily temperature checks at the gate area. Those with elevated temperatures, again, are screened in more detail and possibly sent home and not allowed to work. So there are other controls that we normally do not think of that we now need to think of in this world of the COVID-19 virus. And again, this is what Stewart focused on earlier. I won't go into a lot of detail here. The second step, short-term implementation, shifting work to ventilated enclosures, if at all possible, maybe use of some temporary physical barriers or sneeze guards, altering the process to reduce exposures, wet sweeping methods instead of dry sweeping for housekeeping, that sort of thing. Rescheduling non-essential work, which requires RPE use. Adjusting work schedules to reduce the amount or number of RPE needed. Oops, sorry, I lost my control again here. and prioritizing RPE use to those that are most critically in need of that equipment. The third thing we consider is use of a qualitative fit test method rather than a quantitative fit test method. During periods of significant shortages, qualitative fit test testing may be a better option over quantitative. Qualitative fit testing is not destructive and may help conserve your filtering facepiece respirators. Those of you that are using a quantitative method, such as the TSI port account, you know that you need to essentially put a hole or probe that filtering facepiece respirator, rendering it unusable in the workplace. If you move over to a qualitative fit test method, such as that shown on the left here, that respirator after fit test can be worn in the workplace. So that way you can help conserve your filtering facepiece supply. We can also look at alternative types and classes of respiratory protection. Again, lots of different options for respiratory protection. The key, as Stewart pointed out, is finding a respirator class and type that is going to be suitable for the work environment, provides the proper protection, but is also appropriate and comfortable and easy to use for that respirator or for that worker, so they can continue to perform their jobs. There are things we can do to help extend the service life of RPE. We can reevaluate exposure levels. What are the levels of protection required? Right, reevaluate the levels. Can we switch to a different type of respirator, or even can we reduce the need for RPE in some cases? We can reevaluate the filter changeout schedules. Can filters be used longer than current company policy? Can you extend the changeout schedule? Obviously, we want to pay attention to the respirator user instructions and guidance. There are some classes of respirators that have a limited time use, such as the P class filter, or under the OSHA and NIOSH guidance, right, has a limit of 40 hours per week, 8 hours a day by some manufacturers, so be aware of that. Can we extend use within one shift? If workers are wearing multiple filtering facepiece respirators in one shift, is it possible to adapt the working practices to reduce the number of filtering facepiece respirators used, or maybe just use a single respirator per shift? And then we can look at reuse as well. If used more than one shift, right, if we can work that out, then we need to consider how that respirator will be cleaned, how it will be disinfected. We'll need to incorporate some inspection requirements prior to reuse, particularly for the filtering facepiece respirator. Some respirators obviously are easier to clean and decontaminate than others. We don't have time to go into the details during this webinar, but many types of RP can be decontaminated. The manufacturer, respirator manufacturer, will have cleaning and disinfection instructions. You want to check for approved cleaning methods for the COVID-19 virus or the SARS virus. Many government and healthcare organizations have published a list of disinfectants that are effective for the SARS virus. So you want to be sure to use an effective disinfectant agent whenever possible. But be aware that those in themselves might be hazardous, and the workers may need PPE, particularly gloves, if using some of those disinfectants to clean and disinfect the respirators. This chart simply gives you some idea of which types of reusable filters can be disinfected. Now, only filters which are encapsulated or have a hard surface may be wiped down. Please do not attempt to decontaminate or clean or disinfect the filter media itself. It may affect the filter performance. So that is not recommended by government agencies or respirator manufacturers. Under extreme conditions, what we would call crisis capacity strategy can be implemented, and this has been done in the healthcare field. And again, CDC, NIOSH, and other organizations do not recommend decontamination and reuse of filtering facepiece respirators. But if, again, if there is a crisis, this is something that has been done. At the end of a shift, that filtering facepiece respirator can be stored in a brown paper bag. One respirator per bag. There's evidence that the SARS virus can survive up to 72 hours on a variety of surfaces. So if we store that respirator in that bag for 5 days, we can reasonably assume that any virus that may have been on the surface of that respirator will have died and is no longer viable. And that respirator can be reused at the end of 5 days. If you are going to implement something like this, and actually these suggestions are relevant regardless of the type of respirator, but you want to be sure the workers are washing their hands before and after donning or adjusting their RPE. Avoid touching the inside of the RPE if at all possible. You want to avoid transferring any contamination that may be on the hands and fingers to the inside of that facepiece. We want to be sure that we visually inspect the RPE to determine if its integrity has been compromised. Obviously, if it has been compromised, if it's been damaged, if the elastic straps are no longer elastic, if there's holes in the filter media, do not use that respirator or filter. Discard it and replace it. And as always, we want to be sure the users perform a user seal check each time they don that respirator. If they are unable to pass the user seal check, then we do not want to have them use that respirator. Time to change out and get a new one. Use of RPE beyond the manufacturer shelf life for training and fit testing. So we don't want to use expired filter media. or filters or cartridges in the workplace. We don't know that they're going to work effectively, but they can be used for training and fit testing. So use them for training and fit testing. Save your in-date products for use on the floor. Most product will have a date code, expiration date stamp, either on the product itself, on the inner packaging, or on the outer carton box. There's various formats used, so be sure to check with the respirator manufacturer so you can properly determine what the expiration date is for that product. And lastly, again, if there's a crisis, we can look at using RPE that's approved under standards from different countries or regions. This would include the N95 and the NIOSH, FFP2, Europe, KN95 from China, P2 from Australia, New Zealand, Korea First Class, and the Japan DS model. In most cases, again, these will be stamped. The certification will be stamped or indicated somewhere on the filter itself or the filter media. So be sure that the respirator you're using is certified and compliant. Question 2, PPE options for workers who cannot socially distance and do not normally wear RPE. Stewart referenced some great guidance that's available out there. I'm going to reference or focus a little bit on the OSHA guidance again, but there is very good guidance elsewhere for you to take a look. The risk pyramid that Stewart showed, again, we're looking more at the medium to lower risk groups for the steel industry workers and most other non-healthcare industries out there. I'm not going to go into any more detail on this. I think Stewart did a great job earlier. If you do determine that your workers are in that medium risk group, then what OSHA is suggesting in that guidance is reviewing the need for protective gloves, possibly a gown, a face mask and or face shield or goggles, and in very rare situations, a respirator might be required for that risk group. For that low exposure risk group, right, additional PPE is typically not recommended. Workers should continue to use the PPE they normally use, if any. And again, only under very rare circumstances would a respirator be needed for those individuals. There's a lot of talk and communication about use of some sort of face covering in these situations. Some countries and states are requiring or suggesting use of facial coverings. So be sure to check your local and national guidance on facial coverings for business and the general public. We often get the question, and there's still a lot of confusion about the differences between a mask and a respirator. So let's look at these two again, and let's understand the function of each and their potential role in the workplace, during this COVID-19 crisis. Masks, right, are intended to protect the work environment from substances expelled by the wearer, okay? These were originally designed and intended for use in the healthcare industry. Masks are worn to help protect a patient undergoing surgery, or a patient from the exhaled breath of the healthcare worker. Respirator, on the other hand, right, is intended to help protect the wearer from airborne substances or particles, in this case, in the work environment, whether it be industrial dust or particles or infectious microorganisms as droplets or aerosols, right? So remember, masks help protect the environment and everyone else from the wearer, where a respirator, right, helps protect the wearer from the environment and everybody else. We also get the question about the use of valved versus unvalved respirators. So how does an exhalation valve influence things? The presence of an exhalation valve does not impact a respirator's ability to provide respiratory protection. Really, the valve is included, among other things, reasons to help improve wearer comfort by allowing hot, humid, exhaled breath to escape from the inside of the respirator. So you can see from this graphic here, when you inhale, right, the air passes through the filter media. When you exhale, the air passes through the filter media and through the exhalation valve. With an unvalved respirator, same as with the valves, when you inhale, the air passes through the filter media. However, different from the valved respirator, all of the exhaled air passes back through that filter media. So that there is the primary difference in the function, right, of a valved versus an unvalved respirator. And both are effective in filtering particles. So let's take a look at a specific example here. You see in this photo of a control room. We have several operators here. How do we protect them from the SARS virus? Again, looking at your hierarchy of controls, right? We can look at engineering controls, physical barriers, maybe some administrative controls. We can move those workstations to separate, have that 6 foot, 2 meter separation. That might be sufficient. If that is not able to be done, right, then we consider what OSHA had suggested, maybe a face covering, maybe a face shield, maybe a respirator. Again, so conduct that risk assessment, consider those alternatives. Last question is what is the effectiveness of existing respirators worn in the workplace by workers who cannot social distance? Well, I'll go through these fairly quickly. I do want to leave time for questions here. Again, if that worker is using in their normal operation a particulate respirator, the N95 FFP2 or equivalent or better, they will be protected from the SARS virus. Wearers of RPE, which are using RPE maybe only for gases and vapors, then they will need to include a particulate respirator or a combination filter on that ensemble to effectively remove the SARS virus or particles containing the SARS virus. If worn correctly during all times of exposure, RPE that provides particulate protection will be effective and should help protect against inhalation of the virus. Also look at other control methods, goggles, clothing, that sort of thing. But also consider when and where the RP will not be worn. How will that respirator be stored? How are we going to enforce social distancing during breaks, meals, change rooms, etc. So one other thing to consider there. We haven't talked much about loose fitting face pieces or PAPRs. Real briefly here, a half mask or full face piece reusable functions very similar to, say, a loose fitting PAPR, right? In both cases, air is drawn through the filter, then cleaned, and exhaled air is forced out either through the exhalation valve or through the loose fitting seal on a PAPR. But in both cases, that air, exhaled air, is not filtered. Okay, inhaled air is filtered, the air coming in, whether it's inhaled or drawn through the battery, by a battery or motor blower, is filtered, but that exhaled air is not filtered. So something to be aware of there. We've had a question come up regarding the use of face shields for protecting others against the virus. This is the chart you've seen from Stewart earlier. We've modified it to include face shields. Again, the intent of a face shield is to protect the wearer from mechanical, say, impact hazards or liquid splash hazards only. It's not designed to protect the environment or others nearby. So it's not suggested as a control method to protect others from either large or small particles from the wearer. All right, so one last image here. Again, this is a worker maybe drawing a sample from a furnace here, a melt. Close up, it looks like this operator here may be wearing a filtering face piece respirator. He may be wearing a facial covering. It's hard to tell. If it is a filtering face piece respirator, again, as I mentioned earlier, if it's a certified and approved N95 FFP2 or better, that will be effective against airborne particulate as well as the SARS virus. But as Stewart mentioned, that may not be the most suitable. I would caution those that are wearing respirators underneath other coverings that it may affect the performance and may increase breathing resistance of that respirator, and it may affect the performance. So there are other more suitable options available, such as maybe a PAPR system, integrated system that's shown here, that might be a better option. So I encourage you to explore these other options as well as you do your evaluation. So I apologize, I went a little bit longer than I wanted. Here are some links to additional information should you be interested. And with that, I will pass it back. Stewart, did you have any other comments?
Hi, this is Andy from WorldSteel. We have a number of questions that have come in as we've gone through the webinar. So I know it's now 3 o'clock, but I'm going to take the decision to continue. I don't want to terminate things now because I think that some of these questions will be quite useful for folks to answer. So I think I'll try and summarize and put them together as best I can. There's been a few questions around how often protection should be changed. How often should you change your respiratory protection? How long in one session would these masks be effective for?
Okay, well, I guess I can take this, and Stewart, you can jump in if you have anything to add, but it depends on the type of respirator worn. So if it is a particulate only respirator, an FFP2 and N95, then the useful life of that respirator is determined by mainly by breathing resistance. So when it becomes difficult to breathe, draw air through that filter, then that's an indication that it's time to change that filter. Obviously, you want to change it if it's damaged as well, or if it's just dirty and unsanitary. But damaged, dirty, and difficult to breathe are kind of the guidance we use for particulate respirators. If it is a gas and vapor respirator, right, then employer will determine the changeout schedule based on the environmental conditions, the exposures in the workplace, and the user will be given that guidance on when to change the gas vapor filter based on that known change schedule. That makes sense.
Okay, thank you. Your comments around reusing the respiratory protection through putting them in a bag caused a couple of questions came through.
Yeah.
I noticed you were specific around, you said question one, a paper bag. Is that necessary, or could it be a plastic bag? And the second question related to that is, how many times could you use this 5-day set-aside action? Is it going back to the previous question around how long these things feel effective and aren't damaged for, or is there a limit?
Stuart, do you want to take this one? Oh, maybe not. Okay.
Stuart, are you muted? Oh, okay.
So I'll answer. So a paper bag is recommended. The reason we don't want to use a plastic bag is we don't want to keep the moisture inside that bag. Moisture may cause other issues, other microbial growth, that sort of thing. So we want a dry environment in that bag. So they found that a paper bag is a little bit breathable and lets that moisture escape the bag and provides a better storage condition for the respirator. As far as how many times can it be used, I'm not aware of any specific guidance. I would follow, I guess, what I mentioned earlier with the damaged, unsanitary, or just difficult to breathe, and use that guideline for continued use and when to replace.
If I may, sorry, I was struggling with the unmute button. Just to say, yes, perfectly right on the paper bag. There was a concern that humid conditions may help prolong the longevity of the virus on a surface. So a paper bag or something which is breathable is being advised. I'm not sure it needs to be a brown paper bag, but those are what are commonly used. And just one other point as well, maybe on both questions asked so far. Particulate respirators in normal times, which have been exposed to an infectious microorganism, the best practice would be to dispose of them after a single use. But we're not in normal times. If you've got a ready supply of them, then please reduce the risk and maybe consider disposing. But if supply is limited, you may need to consider the reuse of a filter which is contaminated. So the paper bag method for 5 days is one method. The use of filters which can have their external surfaces wiped down is potentially another. And the virus will not be re-aerosolized off a filter when it's being captured. So there's no fear there. The risk is more around handling a filter.
Okay, thank you. There's been a couple of questions around, we see these cloth masks and to what degree they're actually effective, the science, or if there are any studies around the effectiveness of those masks versus the particulate masks. And also somebody's asked whether a sort of face shield, is that equivalent to using a face covering in terms of the protection that it would offer?
Yes, there's a great debate about different respirators and masks. and I think both I, but particularly Scott, detailed the role of a mask and a respirator. A mask primarily is intended to capture those large droplets expelled when talking, coughing, or sneezing by the wearer. But a mask isn't tight-fitting. Some of the smaller particles which can follow the air will go around the sides of the mask. And if it's a homemade filter, they could even go through the filter material. And there has been some research published which indicates that the filtration efficiency of homemade masks is very variable. And to get high efficiencies involves incorporating many different types of materials and layers. You're almost making a respirator at that point. Masks, that is their role. Respirators, they're intended to protect the wearer by being tight-fitting and filtering all the air which is inhaled. And as we saw in some of those graphics, those with an exhalation valve, they're designed to, for comfort reasons, to let the air out of the mask during an exhalation cycle very quickly and rapidly. Unvalved respirators don't have that feature. Obviously, the air goes back through the filter. It's filtered on the way out as well. That does perhaps impact comfort a little bit. A valved one would be more comfortable to wear long term. Now, we're not 3M aware of any studies looking at what portion or what is escapes in terms of particles and droplets through an exhalation valve. And as there's been no studies conducted, we can't definitively say no virus containing aerosols or particles expelled by a wearer would exit through a respirator with an exhalation valve. But a lot of scientific logic would suggest, looking at particle sizes, impaction, and all sorts of technical terms, that the very largest are quite likely to impact the back of the valve diaphragm and not escape with a valved respirator. So a respirator is intended to protect the wearer, but an unvalved definitely will protect everybody else as well. A valved one may well do, but it's a developing situation. We're looking at what data there is, and others are too. I'm not sure if that fully answered the question.
That's good. And maybe just one point you didn't touch on: the face shield. Could that be seen as equivalent to a nose face cover in practically, or are they very different in terms of their effect?
Face shields have been suggested in healthcare as for two reasons. One is to help protect the eyes, which is another source of transmission, perhaps less so than the inhalable route, but there is a risk there. But they're also being used to help protect the mask or respirator from droplets and fluid splashes. A face shield typically sits further off the face and off the mouth and nose than a mask would do. And in that regard, droplets and particles exhaled are much more likely to get around the edges of the visor than they would if you were wearing a closer to the face mask or a tight-fitting respirator. So they may have some benefit, but likely to be less than a mask and definitely less than a respirator. But we don't really have the data to prove that out, but that is what the science and the aerosol theory would suggest.
Okay, thank you. I just had two more questions. One of them actually I'll speak of for a second. The question about collective transport in terms of what do we do if we can't socially distance on things like works buses. I guess I just wanted to observe worldsteel have been collecting best practices or leading practices from our members, and this has come up as an issue. What a number of our members are doing for their works transport would be to increase the supply where they can of the number of buses available. So one company doubled the number of works buses, really to enable people using those modes of transport to socially distance as best they can. Protection was provided for the driver, and often we've seen, in fact, the front door of buses not used at all. So if buses have a middle door, I know I see that where I am here in Belgium, the front door is not being used and everybody is boarding and leaving the bus from the middle door in order to try and protect the driver. The last I mean, you guys may have some comments on that topic. Just the last question, which I'll give to you, was in some countries, in some regions, there's issues with counterfeit goods. Clearly, people want to make sure they're using genuine protective equipment. Is there any advice you can give to people to help them spot, perhaps from the 3M perspective, genuine goods? And really, is counterfeit goods, from your perspective, is it an issue within your industry that people should be concerned about?
Well, from a European perspective, because the regulatory environment varies around the world, it is an issue in Europe. We're seeing a lot of opportunistic sellers appearing and selling respirators and masks at greatly inflated prices. In terms of the authenticity, there are many products being passed off as tested and certified when in fact they are not. So I would definitely recommend that people get copies of the certification, the approvals for these documents, for these respirators, get the documents, and then if possible, look at them, read them through, compare them to authentic documents, but also maybe go to your national trade associations for PPE manufacturers. So, okay, I'm English, I'm in the UK. The BSIF has a great website and some very practical advice on understanding if a product may or may not be authentic, if it's approved or not, etc. So seek help, go to your regulator locally, go to your trade bodies, and you'll get a lot of really good information. Sadly, there are people who are price gouging. 3M have taken a very strong position on that, and there are people out there who are passing off counterfeit products as well. So if you're in any doubt, please, check out the guidance I've just given, check out the certificates, check out the documentation, speak to your local trade bodies and regulator first. And if in doubt, we can't answer every question, but we'll try to help as many people as we can if they have particular concerns around a 3M product. Also speak to the manufacturer, the original manufacturer as well. It may not be a 3M product, but speak to whoever you believe made it, and they can help you as well.
Yeah, just to add on to that, it is certainly a problem globally, and unfortunately, the counterfeiters are getting very good at copying product. So certainly, as Stuart mentioned, if you have a known good product, compare that to what you suspect may be counterfeit. There might be, fuzzy lines on the printing. Some of the date codes don't look quite right. That sort of thing. Talk to the manufacturer. Also, one other thing that might help or should help is if you continue to purchase through a reputable distributor or supply house. That should certainly help. I think where we get into problems is when we make purchases on say Amazon, Alibaba, or maybe these new distributors that have just recently popped up on the scene. So make sure you purchase through a reputable distributor, and that should hopefully take care of the problem.
That's great advice on which to finish off our discussion today. But I wanted to thank 3M for partnering with us. This has been a fascinating webinar. I'm really pleased with how it's gone. As I think Scott said, we can't answer all questions, but if anyone does have any questions, if you would like to email them to WorldSteel at safety@worldsteel.org, I would be delighted to pass them on to the experts at 3M. They have a broad international network and specialists in most of the countries that you're operating in. I would be very happy to pass any questions that we get onto our subject matter experts. So thank you all for your participation. When you leave the webinar today, you should be presented with a short survey. We'd very much welcome your feedback. Thank you to 3M and thank you for your time. I wish you all continued good health. Thank you.